Pumps are not the answer for everyone.
There are certain individuals where intrathecal treatment may not be the best form of treatment for them. And the first thing is, again, have you tried other treatment options that may be more conservative?
If we're going to talk about a diagnosis that would indicate a poor outcome from a pump, I would say fibromyalgia. Now, there are probably physicians who would argue with me in that regard, and that's where the practice of medicine comes in.
If you have a bleeding issue, it may not be in your best interest to have an intrathecal device. Or if you have a high rate of getting infections, this may not be the best device for you.
Von Willebrand syndrome, or they're on an anticoagulant like Coumadin, warfarin, for instance, or Plavix, or one of those medications. Again, it does increase the risk of bleeding. We typically stop those medications while we're doing the trial and then shortly around the implant, but that doesn't necessarily preclude them from getting the system.
If you have any metal allergies or you have specific allergies that we're worried about, we should probably first, I would recommend that we first check to make sure that you're not allergic to anything in the system.
Patients who have an immunosuppression going on for any reason, cancer patients or chemotherapy, doesn't necessarily preclude them from getting an intrathecal delivery system. However, you need to make sure that they get clearance from their physician who is treating them in that regard.
There's certain individuals that may have certain psychological conditions that need to be better treated before we consider intrathecal treatment. For example, you may have high levels of anxiety or high levels of depression. It's important that we help you with those conditions before we consider progressing forward to implantation.
If you have had a problem with substance abuse, you and your healthcare provider need to discuss this situation openly.
One of the questions that we often get asked is, would we consider this treatment for someone that has a drug abuse problem or someone that's previously had an addiction to opioid pain medications? There's no exact answer to that, but I will tell you that if you have had a previous history of addiction or continue to abuse medications, until you have that under control and until you have that appropriately treated, I would not even consider an intrathecal device.
A patient who has a chronic pain syndrome again, I can hang my hat on a hook. I know they have a real pain problem. Just because they have an abuse problem in the past or they have an addiction problem in the past, that doesn't preclude them from deserving pain relief.
Here are some questions you may want to ask. Why am I a good candidate for this device? Do I have any risk factors that could cause problems?